Despite efforts to prevent suicides among U.S. service members, the rates just keep rising. I want you to take a look at these sobering numbers. A new report looked at service member deaths in the wars following the 9/11 attacks. 7,057 died in military operations. But as you can see here, more than 30,000 active duty personnel and veterans of those conflicts died by suicide. Brenda Lee Baker is the president and co-founder of the Code 9 Project. It's a nonprofit that works with veterans and first responders to try to prevent PTSD and suicide. First off, thank you so much for being here, and thank you so much for what you do. What do you make of these extraordinary figures? I mean, we're talking at least 4 times as many active duty personnel and war veterans dying of suicide than in combat.
Thanks for having us, Heather. Yes, it's a staggering number. My hope is that the viewers connect with the information and understand that we're not setting our servicemen and women that sacrifice and serve their country, and then many of them going on to serve their communities and law enforcement and first response up to succeed. And there's not enough resources out there. We're facing budget cuts in so many areas, law enforcement specifically, that decreases the potential for resources in departments within the military. And the stigma is still present. PTSD still has a stigma, post-traumatic stress injuries. And you couple all of this with a perceived punitive, meaning there's fear that there will be consequences for seeking assistance, and there's a history of that, preventing individuals from getting the help and the resources that they need. And that's just not okay for our organization. If you are serving your country and your communities, it should not be at the expense of your quality of life. So we dedicate our time and our resources and our efforts and our skill sets to provide as many resources, training, and opportunities, peer support groups, canines, trauma canines, as much as we possibly can to prevent PTSD and suicide in the military, law enforcement, and first responder communities.
Yeah, I mean, you are really an incredible organization, an incredible helping hand to our veterans and to those active duty. What does this study, though, say, Brenda Lee, about the persistent mental health challenges facing, those who are active duty service members and veterans, and how do we address these findings?
What it says is that we're all human beings, and we're being asked to do extraordinary work, which is going to require extraordinary resources and health support to sustain the health of our nervous systems. These are stress careers and therefore require stress support. Not sometimes, not in breakdown, but stress support for the prevention of wear and tear. We're asking our military and our first responders and law enforcement to step into situations successively that have a tremendous impact on our nervous systems. We're human beings. We can only do so much. Our nervous systems all respond the same way. And therefore, we really need to start looking at these things from a more comprehensive perspective and less about the theory of stress and it being a strong or a weak mind that determines whether or not an individual can handle this type of work.
Yeah, that is such an important point here. We're just about out of time, but as you mentioned, this is not just a military or a veteran problem. This is an American problem. So what more do we need to do for our troops, both active duty and veterans?
Support organizations such as ours. We're not affiliated with departments or governments, so that we are a clean bridge for people to seek assistance. You can find out more about us at thecode9project.org. Say thank you to your servicemen. Say thank you to your officers and your first responders. There's so much misconception as to what they do and how they do it. More gratitude, understanding, and appreciation of what these individuals are going through is needed. So the public needs to be educated just as much.
Yeah, really good advice. Appreciate you coming on this afternoon. And again, thank you so much for what you do.
Thank you for having us.